Most of us take clean drinking water for granted. Unfortunately for some, safe drinking water is not something they can take for granted. This is particularly true in some of the smaller, poor, rural communities in the valley. A recent UC Davis study found that 35% of the total population of the San Joaquin Valley have nitrate contamination levels in their drinking water that exceeded the state standard, and that number is expected to grow to 80% by 2050 if nothing is done to address the problem. What are the causes and solutions to this problem? We'll ask Mark Rossi, a reporter with the Fresno Bee who covers environmental issues, and John Borkovich, Senior Engineer Geologist for the Groundwater Programs at the State Water Resources Control Board. Water Woes, drinking water in California's rural communities.
From Fresno, the Maddie Report, with Executive Director of the Maddie Institute, Mark Kepler.
Our guest is Mark Rossi, environmental reporter for the Fresno Bee, who has written extensively about the impact of contaminated drinking water in some of the smaller rural communities. Welcome to the Maddie Report. Can you give us some specific examples of what's happening in the affected communities? How does this play out in the daily lives of folks who live in places like Tullyville?
Well, as we were talking about earlier, you avoid drinking the water. You spend a lot of money on bottled water. Some of these people are spending up to 10 and 15% of their incomes first buying water they can't drink from the public system, and then buying bottled water to drink. And they're taking showers in this stuff, and they're washing their clothes in it, and day to day. Tullyville is a great example. Right outside of Exeter, which is a fine little community in Tulare County that has very good water.
So the question is, why don't they just connect to Exeter?
That's the question. That's the question. It's very deep, very complicated. A lot of back and forth issues over who maintains the system and how much they pay, and a lot of suspicions. It's taken years of negotiation, and I don't think that's ever going to work out. Actually,
you were saying off camera that the towns are all a little different. There's a town called Seville. What's going on there?
Seville is a very different case. You get sand in the water, you get E. coli bacteria, you also get nitrates. And they're dealing with the California Department of Public Health and trying to get funding to fix their system, but they keep getting stymied by little technicalities. And it's almost, as I wrote about a couple of years ago in our series, Don't Drink the Water, it's hard to track down what's going on with CDPH, because...
CDPH is what?
The California Department of Public Health. Because I will ask a question about a grant to study a fix, and 1 week it'll be low on the priority list, the next week it'll be back up.
What about, you're talking about the cost for these folks who live in these communities, the cost for water. Mm-hmm. What percentage of their income is being spent on just basic water?
It's like 10 to 15%. In some places it's more.
I think I'd read somewhere that it's 3 times the EPA suggested amount that people are spending. In some of these communities, the average income is about, what, $14,000?
It's something like that, or a little bit higher maybe, but below the poverty level. And, they're just trying to protect their children. Blue baby syndrome is not something that's been documented. Blue baby syndrome comes from nitrates.
Okay.
And if you have a very small child, that's a potentially fatal blood disease from nitrates. And I don't know if you want to get into nitrates, but we can
we will get into nitrates in a minute. Actually, I want to ask you about a UC Davis study. Recently found that nitrate leaching from ag land was responsible for 96% of groundwater contamination. But not everyone seems to agree. Some think it's coming from other sources. What's the discussion going on out there?
Well, I don't think anybody can deny that ag is a big part of it. But the argument that I get from the agricultural community is this is a legacy problem. This is something from 20, 30, 40 years ago, when fertilizer rates were not understood very well, and so there was a lot of over-fertilization. And since the downward migration of water through the soil strata is very, very slow, the UC Davis study says this contamination could actually be getting worse.
Are they saying that they have no responsibility for
Good question.
For the nitrates, or
no? They're not saying that. They're saying that they will monitor and work on what their input is, but a lot of it is a lot farther down, and they're saying they have no they have no responsibility. Not they have no responsibility, they didn't do this part of it. And they're also saying that in individual cases, there are leaky septic systems, there are sewage treatment plants nearby.
Is there any way to track that? I mean, it's going down the nitrates or whatever is going, even the leaky septic tanks, it's going into the aquifer. How do you trace that? How do you know where the source is?
Well, I mean, you got to do monitoring wells, and that's probably the next thing up. You set the monitoring well upstream, and you find out, you know, what the suspected source is. But I got to say, most of it is agriculture right now, according to the Harder report, which that's Thomas Harder from UC Davis.
Okay, well, when we get back, we're going to go in depth on the findings of that UC Davis study on contaminated drinking water with the State Water Resources Control Board, the agency that commissioned the study. That conversation in a moment. This is the Maddie Report.
Welcome back. One of the stated goals of the State Water Resources Control Board is to, quote, ensure that groundwater is safe for drinking, unquote. We're joined by John Borkovich, Senior Engineering Geologist for Groundwater Programs at the State Water Resources Control Board. Welcome to the Maddie Report.
Thanks for having me.
Well, one of your major areas is water quality. Water quality monitoring and environmental justice are key activities of your board. Recently, you commissioned a major study by UC Davis. First, where was the study located?
Okay. There were two reports that were delivered to the legislature earlier this year. One was on the nitrate report, but there was also a report that focused on communities that are reliant on a contaminated groundwater source. So the finding in that report was that nitrate indeed is the most prevalently found contaminant in groundwater sources in the state. So the nitrate report was a good parallel report to have with that report because it strengthened our stance from the standpoint of nitrate as of importance for people with groundwater issues in the state. So our nitrate report that we commissioned with UC Davis focused on identifying those two areas of the state that were specifically stated in the legislation, SBX 21, and the southern San Joaquin Valley, Tulare Lake Basin in particular, and the Salinas Valley.
Okay. Just so how widespread is this problem?
Nitrate, we found, is a statewide issue. Of particular importance are those areas that are reliant on groundwater. So like I mentioned, the other report that we had, some of those regions that are in the southern San Joaquin and also in the Salinas Valley are 100% reliant on a contaminated groundwater source. So they have to either find another source of water that they can blend or treat their water with to get it to safe levels, but some of these communities are unable to do that.
So what is the problem with nitrates? Well, why is that a problem?
Nitrate is a problem because of the fact that there's a health issue associated with it, and our California Department of Public Health has set a standard at a particular level, and when we do any of our studies, we use that threshold or that standard as a means of being able to identify those areas that have particular need.
Okay. What are the causes of the problem? I mean, how does the nitrates, how do they get into the water, into the groundwater?
Well, the UC Davis nitrate report that we commissioned identified that the vast majority of the means of nitrate contamination getting to the groundwater supplies in the state are from agricultural related activities. So there are other local issues associated with other types of contamination, but on a statewide level, the agricultural activities are the main source.
Now, is this a kind of a legacy problem, that this was due to farm practices that occurred years ago, and that you ask farmers today, they're saying that they don't have the same amount of nitrates going into the soil or the contamination going into the groundwater?
Well, it's true that what we see today in groundwater is due to the fact that there were applications of fertilizing materials to the surface, and through time it went through the soil and got to the water table. So overall right now what we're looking at is a legacy issue. According to some estimates by the UC Davis report, it can take decades for the application at the surface by the time it gets down to the groundwater. So it's an ongoing issue.
Are they monitoring, are farmers now, they're monitoring nitrates that they're using, they're supposed to be monitoring that, is that correct?
Well, there are both of the regional boards, in particular, that are dealing with this, is our Central Valley Regional Board and the Central Coast Region. Both of those regions have programs where they're looking at irrigated lands to identify a means in which to monitor the groundwater in those areas.
So it sounds like a pretty big problem. What's the cost of the cleanup?
Well, as far as cleanup is concerned, the UC Davis report identified that the cost associated with actually cleaning up is so astronomical that the focus would be better suited if we looked at identifying those areas that need safe drinking water and to focus those resources at that. And even still, on a year in and year out basis, estimates are between $20 to $35 million a year on an ongoing basis in just these two areas of the state to focus on safe drinking water issues.
You also provide financial assistance. What financial assistance is available to those poor rural communities that have those contaminated wells?
Well, the safe drinking water funding comes from our sister agency, the California Department of Public Health. There are various means. Recently, but that doesn't mean that the state boards doesn't help with respect to those areas that do need help, like small disadvantaged communities. But I wanted to make it clear that the safe drinking water aspect of it is a public health issue. But recently, the water boards worked with the California Department of Public Health and identified funding through their cleanup and abatement account to the amount of $2 million to help assist those areas that have efforts forth where they're looking at getting a safe alternative source of drinking water.
Okay, well, thank you very much for being here. Up next, we'll find out what's the holdup with spending $455 million in federal dollars that's been allocated to clean up contaminated wells, and whether developing a regional water plan is on anyone's agenda. That conversation in a moment. This is the Maddie Report. Welcome back. One of the core activities of the California Department of Public Health is, quote, protecting the public from unhealthy and unsafe environments, unquote. Making sure there's access to clean drinking water is clearly within their mandate. So what is the California Department of Health doing to make sure residents in rural communities have access to clean drinking water? Unfortunately, despite our repeated requests, no one from the Department of Public Health was made available to answer any of our questions. As a result, we're rejoined by Mark Rossi of the Fresno Bee to provide some information on what the Department of Public Health is or is not doing to ensure access to clean drinking water in California's rural communities. Welcome back, Mark. So recently it was reported that $455 million in federal EPA money was allocated to the California Department of Public Health to clean up contaminated wells in California, but that it's gone unspent. What's the story?
Well, the story is that the money isn't missing in some account in the Cayman Islands or anything. It's the story is that they have allocated that money to different projects, but the projects have not begun and they haven't gone through any official process, so we don't know where that money is. There's no way to track the documents. And that's what the problem is. It needs to be more transparent from my point of view as a reporter. If I can't get to that information, you can't get to that information.
One of the things that the EPA said in their letter to the Department of Public Health was that they were concerned that there weren't enough shovel-ready projects. Is that true? And if so, why haven't short-term projects been approved so they can be implemented immediately?
Yeah, ironically, the shovel-ready project name was to try to get money out there faster to things that were ready to go. Problem is, many of the smaller, and I should, to be fair to the Department of Public Health, there are many thousands of projects going on, and many of them are funded, and many of them are moving along. But for the poorer towns that don't have the support of a lawyer or an engineer or some sort of expertise to help them get through, you can forget it. You're not going to get past the Department of Public Health because they act more like a mortgage banker filling in requirements than a public health agency helping people get healthy water.
So it's more about process than results? Dot your I's, cross your T's?
It's completely about process. Any small thing can blow up your application. You can spend 6 months thinking you're on the right path and have the rug pulled right out from under you.
You know, I assume that the Department of Public Health has a number of programs that provide funding opportunities for some of these public water systems. Are you finding it difficult for communities to access that funding?
Yeah, I mean, that's exactly what I'm talking about. There's something called a Safe Drinking Water Fund. It's called a revolving fund. I don't know where all these names came from. Revolving is a good word because it seems to be moving all the time. Any kind of little technicality can knock you out, and it's really sad. These people sit and wait for years and years to get at this money.
And are they talking to their legislators? And what are the legislators saying?
Legislators are just as frustrated. Assemblyman Henry T. Perea is the guy I talked to with quite a bit. And at the moment, there's Assembly Bill 145. Mm-hmm. They're trying to get that through to basically to move this out of the Department of Public Health's purview. Because
who's pushing back on that? Is that the department because it's just a territorial thing, or?
It's very odd. I have heard that there is opposition, and I'm not sure I understand why. I've heard it from bigger cities, and not in the San Joaquin Valley. So you know we are talking about a state issue. We're talking about an agency that the Department of Public Health is a $3.5 billion agency attached to a bigger administrative department that's $88 billion. It's a little tiny corner. And we're even a smaller corner here in the San Joaquin Valley. That's why we're not getting a lot of attention.
Well, let me ask you this. Even those poor rural communities that can access these funds, are they having a problem then paying back the loans that they get to maintain these treatment facilities?
There have been problems in the past, but you know, I think the Department of Public Health is very careful about who they give the loans and grants. That's one of the positive things you can say is they make sure there is a cash flow coming in, unlike a certain other situation we've talked about in Fresno County that happened a few years ago down in Lanier.
Okay. Well, up next, a discussion of some of the solutions to the problem of groundwater contamination in the San Joaquin Valley. That conversation in a moment. This is the Maddie Report. Welcome back. We're talking with Mark Rossi, environmental reporter for the Fresno Bee. You know, there seem to be a myriad of state agencies responsible for water quality. You've got the State Water Resources Control Board, you've got the California Department of Public Health, you've even got the California Department of Food and Agriculture. With responsibilities so diffuse, have you found it difficult for residents to get their problems solved?
Yeah. You have a difficulty knowing even who to ask, and there are more agencies than even that. And the best example is the little town of Lanier near Riverdale in southwest Fresno County. 6-7 years ago, the federal government funded a $1.3 million arsenic treatment plant. It went through the county of Fresno, and it went through an expert engineer. And despite all that official and expertise, they still wound up coming up with a plant that the town couldn't afford. It lasted 5 months, I think, and they shut it down and were $100,000 in debt. It's the best thing in Lanier right now is this shiny...
That's not up and running.
This shiny, non-used treatment plant.
The residents must be incredibly frustrated.
Oh, they are. They are. I mean, and that's the kind of oversight, the single agency type of thing that I think Henry T. Perea is trying to get a hold of.
And there's some talk you were saying earlier about shifting maybe some of the responsibility for the funds from the Department of Public Health to the State Water Control Board? To
the Department of Water Resources no, actually I think it is the board that you're talking about. And the board is more responsible for what they call dirty water, for contamination.
Yeah, and what I've been reading is that some of this stuff comes from irrigation ditches that just pours into the wells, and these wells are relatively shallow, and that's how the nitrates get into the water, and that's why it's so contaminated.
Well, there are lots of ways that they can these kind of contaminants can get in. In the town of Seville that we were talking about, there is an open ditch and cracked pipes, and that's not how nitrates get in. That's how the E. coli and the other bacteria get in. These people get notices every couple of months. Don't drink the water.
Well, Governor Brown last year signed the Human Right to Water Act. What did it do?
Well, I think that's very important. I think what it does is it sets the tone and the agenda. It doesn't say you must do this, you must do that. It puts as part of the state's philosophical and stated approach that people deserve at least clean drinking water. And and it can be cited in any number of cases when you're trying to change laws, make things easier. It's when the United Nations came to Tulare County in 2011, it was just hard to believe that they viewed Tulare County like a third world nation. And they were going to some very, very poor countries. And Tulare County, and Seville in particular, rated right alongside of them.
Well, you were talking about new legislation that's being proposed. One is this AB 145. Mm-hmm. Is there any other legislation being proposed? And specifically, what about improving monitoring and notifying individuals in these smaller communities or people who have private wells?
Actually, there were several of these bills passed a little after the Fresno Bee's series on Don't Drink the Water in 2011, but they continue to tweak these things. One of them was that you could get 100% funding if you're a very poor community to fix your problem. It used to be 80%. And one of them was that if you have a certain percentage of people who don't speak English, you have to put out your notices in whatever language that is. Usually it's Spanish in the Latino towns.
Mm-hmm. What about data on the causes? Do people think that they need more? This needs more study, or is the UC Davis study considered definitive, and we now know what the problem is? Oh
well, I think UC Davis study was a very broad study over the entire valley, and the Salinas Valley. I think that when you want to know more about who should pay and how it should be cleaned up, it's going to have to be very specific information. So yeah, I think the underground is a vast situation that we have not looked closely enough at, and I mean, California in general has not paid a lot of attention, enough attention to the groundwater. At least that's the impression we get when we report on it.
Is there any direction at the state or federal level to put more emphasis on nitrates, either on the front end with regulation, fertilizer regulation, or on the back end, maybe with leaching regulations and/or a tax, a fee, a fertilizer fee?
Both. Yeah, both. And and beyond that, there's also this idea of pumping to irrigate, since the water has nitrates in it, and fertilizer is essentially nitrates. If you have nitrate-laden water, you could mix it with cleaner water and raise your fertilizer, basically the ability to fertilize, and get rid of that water, get it up and
it dilutes the nitrates in the water. What about the cost of cleanup? You see different estimates. One was EPA, I think, said over 20 years it will cost $40 billion. Others say that it's going to cost $36 million a year. Is a fertilizer fee or something like that enough to offset the cost of cleanup?
It could easily be, yes. And that's something, but that's going to be a real tough argument in Sacramento. There already is a fertilizer fee, but that's basically for public education, and that brings in about $1 million a year.
$1 million, and the cost for cleanup is $36 million.
That's the rough estimate in dealing with all the little problems as they come up. We're not talking about the whole basin now. We're talking about cleaning up water where people drink it.
Right. So, but I'm just saying, right now we have $1 million coming in to clean up a problem that people think is going to cost $36 million a year.
Yeah. Well, I mean, to be fair, that $1 million is for education, basically, to tell people how better to fertilize.
Okay. So it's not even for cleaning up.
It's not really. No. No.
Wow. Okay. One last quick question. That is there any comprehensive plan or thought of a plan by the federal or state government to deal with this problem?
By the
federal or state government, a comprehensive plan?
No, I think you're looking at it. I think that the study by Thomas Harder was the beginning of it, and now they're formulating how they're going to go about it, and that's going to answer that question. But again, everything takes years and years, and these people they're still waiting. I wouldn't live in those places and try to drink that water if I knew that it was contaminated like that, but some people don't have a choice.
Well, hopefully a solution will be found. I want to thank Mark Rossi from the Fresno Bee for joining us. If you want to stay up to date with local and state politics, you can sign up for our free, award-winning e-newsletter, The Maddie Daily, just by logging onto our website at maddieinstitute.org.
And now, another perspective.
Groundwater contamination is a complex subject affecting every part of our San Joaquin Valley. It is not limited to nitrates affecting disadvantaged community water supplies. It is a statewide issue that does not discriminate as it relates to location or population. Nitrates are pervasive in our environment. Nitrates come from a number of human sources, including fertilizers, animal manure, septic systems, municipal wastewater, and occur naturally in our soils. It is an important agricultural input critical for our food production. Many farmers adopt technologies and practices to align nitrogen applications more closely with the needs of growing crops and protect the underlying water quality. It is important to recognize that there are a significant number of programs and regulations in place at the state, regional, and local level to address this issue. These efforts include monitoring water quality and implementing practices to prevent and control water quality degradation. Drinking water issues are dynamic, diverse, and complex, but local solutions have proven to be successful. Local agencies are actively engaged in developing and implementing holistic solutions through local programs. It is critically important that our elected officials continue to support this grassroots level focus through funding development and governance mechanisms that keep all interests working together toward regionally developed solutions. Keeping groundwater usable for drinking, environmental, and farm uses is a priority for everyone who has a stake in sustaining our region's economy and quality of life. For the Maddie Report, I'm David Orth from the Kings River Conservation District.
The views expressed in the Maddie Report are those of the individuals participating in the program and do not necessarily reflect those of the Maddie Institute, the California Channel, Casey, or Valley PBS. If you'd like to share your thoughts about the points and opinions shared in the Maddie Report, visit our website at valleypbs.org/Maddie.
This is Mark Kepler for the Maddie Report. Thanks for joining us.